primary promise: building the nation's model health system for children. What if you could help young people facing mental health conditions access quality, life-saving services? A vital part of our primary promise vision is addressing the current mental health crisis among our youth.
Unfortunately for Utah and much of the surrounding areas out west, suicide is the leading cause of death for young people. Rates of mental illness for youth and kids continue to increase.
School's been harder, family life has been harder, and one of the things that Primary Children's is really committed to doing is showing up for those families and providing support for them. How do we ensure that every family gets the support and the services that they need?
My name is Kyla. I am mother to 3. Liz is my middle child, 17. She is the most kind-hearted child I have ever met. She has a wicked sense of humor, quick-witted, and talented. The way she can express herself through art is pretty incredible.
When I was 7, so 2nd grade, we moved from Nevada to Utah. That was a very hard thing for me, but things did not really pick up until 5th grade when we moved to this house, and I lost all of my elementary school friends.
The chaos of junior high just made everything come forward for her.
And at that point, I was first kind of coming into school avoidance and anxiety. I don't want to do this. I'm tired of being different than all the other kids.
She was missing school constantly. She struggled every day to go. She would have a full-blown panic attack, running through the house, hitting herself in the head. I can't do this, I hate it, I hate it, I hate it. After we'd had about the 3rd one of those panic attacks, I knew we had to get some help.
With Primary Children's Behavioral Health, we really believe in the importance of getting kids to the right treatment at the right time in the right place.
Our behavioral health vision is bold and offers many enhancements, including the Assessment, Referral, and Consultation Service, or ARCS, where we screen, triage, and place children in the right services, both virtually and in person. Stabilization and Mobile Response, or SMR, a partnership with the state to bring immediate crisis response and stabilization services directly to a patient's home. And care options expanding well beyond the hospital walls via telehealth and our outpatient services. Our center will also connect families to local providers and services throughout the Intermountain West. There's often nothing more important to healing than the presence of loved ones. That's why a critical feature of our vision for the future of pediatric behavioral health is family-centered care, the intentional inclusion of a child's family in their journey.
I contacted the behavioral health unit. The initial contact up there was with Dr. Kaplan, and she was just so welcoming.
She talked to me like an adult, which I really liked.
A lot of the therapy is teaching parents how to cope because we need it, and having those tools was huge.
We're excited for the Behavioral Health Center rebuild happening soon with your support. A new 90,000 square foot facility and campus, including major expansions in outpatient and inpatient services, as well as crisis outreach.
So Primary Children's Behavioral Health, we're actively expanding our programming. We're expanding intake and initial assessment and referral and consultation, crisis intervention services. We're expanding our infrastructure. It's this really exciting opportunity that we have to elevate where Primary Children's Behavioral Health is going.
Through philanthropic support, we can make sure that young patients get the services they need. Every day we delay is a missed opportunity to help a child thrive. With stakes this high, we cannot hesitate.
You meet these kids and families in such a time of crisis. The hope that emerges afterwards is really cool to be a part of. Now we've got that hope for moving forward and what next steps are gonna look like.
It has led me up to a point where I'm very happy, and I'm really, really proud of myself. I feel very fulfilled.
She's doing great. She's on track to graduate. She's talking about a future. She's talking about things she wants to do when she's grown. I would just tell anybody that is struggling, they are caring, they're kind, they're not gonna judge you for where you've been. It's gonna make me tear up. It was an absolute lifeline for us. I mean, they saved my kid, and that's something I could never repay.